patient came in a while back. She was shopping for upper eyelid surgery. She'd done her homework, she had a list of questions, and near the bottom of that list she'd written, "Make sure it's a laser and not a scalpel." I asked her what she meant. She said 3 different practices had laser eyelid surgery on their websites, and all 3 of them charged more for the laser version. So naturally, she assumed that laser is better. And hey, I get it. Laser sounds way cooler than knife. But that is exactly the impression these websites are designed to create. And in this video, I'm going to tell you when laser is better and when cold steel, as we surgeons call this, is the way to go. Stay until the end. I've got a single question that will cut through any laser sales pitch in 30 seconds and tell you almost everything you need to know about the surgeon who's making it. I'm Dr. Keon Eftekari, oculofacial plastic surgeon at the Eyelid Center of Utah. My entire practice is the eyelid area. Now listen, full disclosure, I own a laser. I use it. I love it in the right situations, which is exactly why I can tell you when it doesn't matter and when it actually might be working against you. Let me be fair to lasers first. There are 2 applications where laser technology is genuinely, unambiguously better. Not marketing, real clinical advantage. One is vision correction surgery, or LASIK. LASIK uses a laser to cut an ultra-thin flap in the cornea, the clear front surface of the eye. That flap has to be cut to a depth measured in microns. A micron is 1/1000th of a millimeter. No blade can do that reliably. The laser doesn't just do it better, it's the only tool that makes that type of surgery possible. The other type of laser that has an advantage is lasers for skin resurfacing, treating fine lines, sun damage, surface texture. A scalpel can't resurface skin. These are completely different tools for completely different problems. So vision correction surgery, skin resurfacing. Real advantage, not up for any debate. Now here's where it gets complicated. A lot of laser eyelid surgery, laser blepharoplasty, really means this. It's a standard surgical procedure, the same exact procedure I would do with cold steel. But for one small step, making the first cut, the surgeon swaps out the scalpel for a laser. That's it. The rest of the surgery is identical. Now, here's why some surgeons do it. The laser cauterizes small blood vessels as it cuts, so maybe a little less bleeding in some cases, maybe slightly faster for the surgeon to do the procedure, and that sounds good, but here's where I need you to pay attention. That same cauterization creates a zone of thermal damage in the tissue surrounding the incision. Heat that's spreading into tissues you weren't trying to cut. That thermal damage can slow down healing, and in some patients, and this is the part that the marketing never mentions, it affects the pigmentation of the scar. So a faint strip along the incision line where the skin heals lighter colored than the surrounding area. In a scar that's supposed to be invisible, that's not a small thing. Compare that to cold steel. A sharp blade in skilled hands cuts cleanly through tissue. No heat, no coagulation zone, no thermal spread, just a clean edge that the body knows exactly how to heal. For upper eyelid surgery specifically, the most common eyelid procedure, there is no published evidence showing that a laser incision produces a better outcome than a blade. So the laser gives the surgeon maybe a tidier operative field and shaves maybe a few seconds off of surgery, and the laser gives you a price upcharge and a really cool sounding surgery. But it can also give scar characteristics that would not exist with the blade. That's the honest trade-off. I want to say something that's a little uncomfortable. If you've already had laser eyelid surgery or you're booked for it, this video is not meant to alarm you. Most people do fine. The thermal effect is usually subtle. Many surgeons who use lasers are skilled and genuinely prefer them, but here's what bothers me. The marketing never presents that trade-off. It just presents laser as an upgrade. It must be better. And patients reasonably and logically hear laser and they think more advanced, more precise, better result. But that assumption is being monetized. You are paying more for a tool that for your specific procedure may produce a result that is equal to or slightly worse than a blade. And nobody on that practice website told you that. You're in a consultation, the surgeon has just quoted you a laser upcharge. Ask them this: why do you prefer using a laser for my incision compared to a scalpel? And what could go wrong with a laser? That's the question. One sentence. Here's what a bad answer sounds like. It's more precise, faster healing. It's the latest technology. Those are marketing words. They don't acknowledge that trade-off. Any surgeon who gives you those answers either doesn't know the trade-offs or they don't want to tell you. Here's what a good answer sounds like. The laser cauterizes as it cuts, which gives me a cleaner field during surgery. The trade-off is some thermal spread to surrounding tissues. Now, for your skin type and the incision placement, I think that's manageable because A surgeon who can answer that way, who can kind of name the mechanism and acknowledge that trade-off, is a surgeon who is using the laser deliberately. That's who you want operating on your face. The specificity of the answer is the test, not whether they use a laser, whether they know why they use the laser. That patient that I mentioned at the start, the one who came in with the "make sure it's a laser" written on her list, we talked it through. I explained the trade-off, the thermal zone, the cold steel alternative. I told her that for her case, her skin type, her incision placement, I was going to use a blade. She looked at me and said, "None of the other consultations told me any of this." And that's the problem. Everyone upcharges for this, but nobody talks about what it really means. It's taking advantage of your ignorance, and the purpose of this channel is that information is power. If you want honest breakdowns of what cosmetic surgery marketing is actually selling you, hit subscribe. I put out content like this specifically so you can walk into any consultation knowing more than they expect you to. And if you're researching eyelid surgery and you want to talk through your specific situation, the consultation link is in the description. I'll see you in the next video.